All right, everybody, Dr. Rafich here from Vet Triage. We are going through this issue of JAVMA from January 15, 2015, and we are looking at this study here. It comes out of the Animal Medical Center from New York City. Double pigtail, ureteral stenting, and renal pelvic lavage for renal-sparing treatment of obstructive pyonephrosis in dogs, 13 cases, 2008 to 2012. So, right away, 13 dogs, not a lot of dogs. And so we take that into consideration. We look at this study. It is a very cool study, very niche and advanced, but we have to take into account there's only a small number of dogs in this study. The objective is to describe the technical aspects and clinical outcome of endoscopic and fluoroscopic guided ureteral pelvic lavage and ureteral stent placement for treatment of obstructive pyonephritis in dogs, or pyonephrosis in dogs. Retrospective, 13 dogs, 14 obstructed ureters. Results: 13 dogs, 14 ureters had unilateral or bilateral ureteral obstructions and pyonephrosis due to ureteral lithiasis or a suspected ureteral stricture. 11 dogs had positive results of bacteriologic culture of urine obtained from the bladder, the renal pelvis, or both. 10 were thrombocytopenic, 8 were azotemic. Stents were placed fluoroscopically with endoscope or surgical assistance. The median hospitalization was 48 hours, median follow-up 480 days. Intra-op complications, 2 patients, one with stent occlusion from shearing complications of the guide wire, and the other was wire penetration of the ureter at the location of the stone. Short-term complications was a bladder hematoma in one dog and transient dysuria in another dog. Long-term complications were stent incrustation, one dog, stent migration, one dog, and tissue proliferation at the ureterovesicular junction, 5 dogs, which had no clinical implications. Recurrent urinary tract infection, 7 dogs. Conclusions: ureteral stenting was a successful renal-sparing treatment for obstructive pyonephrosis in dogs and could often be performed in a minimally invasive manner. Let's go into it. Introduction. Pyonephrosis, also termed pyelonephrosis or renal pelvic abscess, is where a dilation of the renal pelvis has purulent material associated with the ureteral outflow obstruction. Causes of obstructions include stones, purulent material, blood clots, strictures, tumors, polyps. Sepsis is a common sequela of pyonephrosis. In humans, 25% of septic patients have a source of sepsis within the urinary tract. The criteria for sepsis include 2 or more of the following: either high temperature, high heart rate, high respiratory rate, leukocytosis in the presence of an infectious source. Thrombocytopenia, high bilirubin, hypercoagulability, neutropenia, toxic changes with the neutrophils are all other findings. In humans, the surviving sepsis guidelines recommend source control or removal of the septic nidus that should be achieved as soon as possible. In humans, ureteral stones are an important contributing factor in the development of pyonephrosis. 20% of all human cases of urosepsis are associated with ureteroliths. In the veterinary literature, clinical correlation among pyonephrosis, sepsis, and ureterolithiasis has been anecdotally noted. The standard of care for pyonephrosis in human medicine involves emergency drainage of infected urine via endoscopic retrograde lavage and ureteral stent placement, or the insertion of nephrostomy catheter. Both procedures are reportedly highly effective. Success rate range between 84 to 100% in humans, and the rate of recovery is over 95%. Complications of nephrostomy tubes in humans and veterinary patients include hemorrhage, infection, tube displacement, urine leakage, puncture into other organs. Given that nephrostomy tubes do not establish patency of the ureter, a second procedure to address the obstruction is required after stabilization. Complications specific to ureteral stenting reported in humans and animals are minor and long-term. For both humans and veterinary patients, these complications include stent migration, incrustation, ureter tissue reaction, hematuria, recurrent UTI, ureterovesicular reflux, and dysuria. In human patients, the decision of which technique is to use is based on clinical preference, patient stability, anatomy, coagulation status, underlying cause of obstruction, expertise of the treatment team, and available equipment. Information on the treatment of pyonephrosis in the veterinary literature is sparse. Previously described include ureteronephrectomy, nephropylotomy, ureterotomy. These techniques have disadvantages of requiring abdominal surgery, risk of abdominal cavity contamination, and permanent loss of renal mass. Ureteronephrectomy should be avoided when possible, given that the underlying etiology is an obstructed ureter rather than diseased kidney, and concurrent pyelonephritis is likely to affect both kidney functions. And these patients are prone to urolithiasis that could develop in the contralateral ureter and cause obstruction. 2 studies found that nephrectomized patients with high creatine following surgery. In one of these studies, which included only previously non-azotemic dogs, 9 out of 21 developed azotemia within 6 months after surgery. So right away, again, I always have an issue with people not converting these numbers to percentages. But it's such a small number of animals, it probably doesn't matter anyway. But, this supports the suggestion that renal function should be preserved whenever possible, encouraging renal-sparing treatment. In a previous study, 16 dogs undergoing surgery for obstructive ureterolysis, which is a substantial number of complications reported, including post-surgical stricture, stone re-obstruction, recurrent UTI. 3 out of 16 dogs was converted to a ureteronephrectomy because of presumed inability to salvage the ureter safely during surgery. 4 of the 16 dogs died because of progressive renal disease. Prior studies have established that ureteral stents are well tolerated in dogs, and the retrograde placement of stents can be achieved via cystoscopic or fluoroscopic guidance. Materials and method. These cases were between 2008 and 2012. Short-term complications were those that occurred 14 to 30 days after the procedure. Long-term was after 30 days. Patients were classified as either as having sepsis on initial exam if they met at least 2 of the following criteria: high temperature, so over 102.5 degrees Fahrenheit or 39.17 degrees Celsius; high heart rate, so over 120 beats per minute; high respiratory rate at over 50 breaths per minute; and leukocytosis at over 16,000 leukocytes per milliliter in the presence of an infectious source. All right. Antimicrobials were chosen on the basis of results of microbial culture and antimicrobial susceptibility testing. If that wasn't available, they would use either ampicillin or sulbactam or enofloxacin. Let's see. And here are the pictures I have on the screen there. Those are step by step what was done. This is a pug, and from A to H, they show entering the ureteral orifice and doing what they have to do, and then urine would come out when they obstructed the pet. And then for this image here, that fluoroscopy shows the kidneys. The first view there on the left, on this side, has the problem, and then it's after the release is the next view over. So, and then those are the syringes with the really gross fluid in them that they got from the kidneys. All right. Results. Most common breeds: Yorkshire Terrier and Bichon Frise, amongst other. Median age 9.5 years. Median weight 8.5 kilograms. High body temperature, median of 39.28 degrees Celsius or 102.7 degrees Fahrenheit. Tachycardia, median of 128 beats per minute. Neutrophil count, high, median of 13,500 per microliter. Band neutrophils, median of 346 per 5.5 band neutrophils per microliter. Toxic changes in neutrophils were seen in 4 dogs. 7 dogs had a non-regenerative anemia with a median hematocrit of 35.6%. 10 dogs, thrombocytopenia, median of 61K platelets per DL. 8 dogs had high creatinine, median of 2.1 mg per DL, high BUN, and 7 dogs, median of 30 mg per dl. 5 dogs had high phosphate, median of 8.8 mg per dl. 8 were low albumin, median of 2.2 mg per deciliter. All 10 dogs, 10 out of 13 dogs had high enzymes, alkaline phosphatase, median of 258 units per liter. Hematuria in 9 dogs, pyuria in 7 dogs, bacteria in 5 dogs. Bacterial culture obtained via cysticentesis, positive in 7 out of 13. 5 out of 6 with negative results of culture of the urine and bladder were receiving antimicrobial treatment. Bacterial sepsis, isolated E. coli in 4 dogs, staphylococcus in 3 dogs. All 13 dogs met the criteria for sepsis. Abdominal radiographs, 11 out of 12 dogs had uroliths. 7 dogs had nephroliths on the side with the obstructed ureter. 5 had nephroliths on the other side. Abdominal ultrasound performed in all the dogs. 12 had unilateral ureteral obstruction. Proximal ureter was affected in 4 dogs, mid-ureter in 6 dogs, distal ureter in 4 dogs. The median obstructed ureter diameter proximal to the obstruction was 9 millimeters. Retrograde uretropylography, confirming ureteral obstruction, hydroureter, hydronephrosis. Let's see. Here is ultrasound images of a kidney before and after stent placement. So before, you can see in A that the kidney was full of fluid, dilated, and then in B, it was not full of fluid anymore. Stone analysis performed in 5 dogs. Calcium based in 3 dogs with 100% calcium oxalate monohydrate or 50% calcium oxalate monohydrate and 50% calcium phosphate. And then struvite based, 95% struvite, 5% calcium phosphate. Another dog had a mixed composition of struvite, 65%, and urate, 35%. Treatment, successful retrograde stent placement with cystoscope and fluoroscopy achieved in 11 out of 13 dogs. Included in these were small male dogs at 2.2 kilograms. Wow. In which case they performed a percutaneous keyhole cystoscopic approach rather than a retrograde urethroscopic approach to gain access to the ureterovesicular junction. Intraop complications, 2 intraop complications. One was converted to a laparotomy, and a single uterotomy was performed over the obstruction to remove the stone. And then the other dog, the stent was occluded by the outer coating of the guide wire and underwent a second procedure later on to exchange the stent. Perioperative outcome, 11 dogs were reevaluated within 14 days after the procedure. Long-term outcome, median of 480 days after the procedure, and 5 dogs remain azotemic. Minimal renal pelvic dilation on ultrasound was seen in some of the dogs. Recurrent UTI in some of the dogs. Some of the bacteria were Streptococcus, Proteus, E. coli, Staphylococcus, Enterococcus, Enterobacter, and Pastorella species. The only major long-term complication, meaning over 30 days, requiring an additional procedure, was a dog that developed encrustation of the stent, leading to occlusion of the ureter 5 months after placement. And then minor long-term complications was a transient dysuria, which resolved spontaneously over 1 or 2 days in 3 out of 12 dogs. All right, discussion. Results of the present study suggest that ureteral stenting is an effective renal-sparing treatment for obstructive pyonephritis in dogs. 11 out of 12 dogs in this series, renal pelvic lavage and ureteral stent placement with endoscopy and fluoroscopy guidance. No dog required removal of an infected or obstructed kidney. So whenever possible, a ureteronephrectomy should be avoided. A ureteral obstruction secondary to obstructive ureteral lithiasis and associated pyonephrosis should be considered in dogs with hydroureter, hydronephrosis, and systemic signs of infection. 12 out of 13 dogs in this study were breeds that were predisposed to formation of calcium-based stones: Shih Tzu, Bichon Frise, miniature Schnauzer, Lhasa Apso, miniature Poodle, and Yorkie. Hypercalcemia, hypercalciuria, hyperoxaluria, hyperlipidemia is associated with these stones, as well as decreased solubility of calcium oxalate compounds that may occur in an acidic environment. Initial clinical signs that have been reported: lethargy, shaking, inaptitude, vomiting, diarrhea, abdominal pain, polyuria, polydipsia, incontinence, stranguria, polyuria, hematuria, flank pain, sepsis, fever, high heart rate, leukocytosis, thrombocytopenia, high bilirubin, low albumin, high alk phos, and all 13 dogs had at least 2 of these abnormalities. Anesthetic complications, coagulopathies, hypotension, and organ dysfunction due to hypoperfusion are all concerns. In human patients with suggest prophylactic platelet transfusions if they have platelet counts that are less than 50 to 100,000 platelets per deciliter. Because over 75% loss of renal function needs to occur before a dog becomes azotemic, the findings suggest that a contralateral kidney was not functioning normally at the time of initial examination. Prerenal azotemia, sepsis, bilateral pyonephrosis, chronic kidney disease, or a combination are possibilities. In 5 out of 9 dogs that had cultures of the urine from multiple locations, they were discordant, meaning one was positive in one location, negative for another. Another study found similar results in 4 out of 13 dogs with cultures that were discordant results. Struvite stones are associated with alkaline urine produced by infections with urease producing bacteria, including bacteria of the genre Staphylococcus, Proteus, Klebsiella, Corynebacteria, and Mycoplasma. Main complications reported to be associated with ureteral stents include dysuria, stent migration, ureteral reocclusion, stent incrustation, ureteral reaction to a stent. In this study, chronic dysuria from the stent was not seen. This has been reported to occur in 50 to 80% of humans and 20 to 40% of cats. In cats, it's been it's been the clinical experience that most of the signs associated resolved with steroid treatment, but this was not needed in any dog in this study. Stent migration is another reported complication in humans and cats, also not occurred in this study. Ureteral reocclusion occurred in 1 dog associated with incrustation, not a common phenomenon in dogs or cats, and very common in people. After stent placement, subsequent urinary tract infection was seen in 7 out of 12 dogs discharged from the hospital. In all these dogs, infections resolved with 6 to 8 weeks of antimicrobial therapy. So they recommend 6 to 8 weeks of treatment with appropriate antimicrobial based on culture, with urine performed 1 week after the culture, with culture of urine performed 1 week after treatment, 1 week before stopping treatment, and then 1 week after stopping treatment. Recovery of renal function and the risk of developing chronic kidney disease following ureteral the recovery of renal function and the risk of developing chronic kidney disease following ureteral obstructions are impacted by the duration of obstruction. In 1 study of 5 healthy dogs with experimentally induced ureteral occlusion, after 7 days of obstruction, the patient's glomerular filtration rate was permanently diminished by 35%, and when the obstruction lasted for 14 days, the glomerular filtration rate was diminished by 54%. Finally, in conclusion, ureteral stenting for treatment of patients with pyonephrosis may be a valuable therapeutic option, which compares favorably to traditional surgical techniques like pylotomy, ureterotomy, and ureteronephrectomy. This minimally invasive procedure offers the ability to maintain the integrity of the urinary tract while preserving the kidney and providing long-term protection for future obstructions due to ureteroliths. The advantages of stenting versus traditional surgery is important with dogs with concurrent risk of sepsis, thrombocytopenia, chronic kidney disease, and future urolith formation. Endoscopic placement of a ureteral stent is challenging, and advanced training with scoping and interventional techniques is recommended. Prior to attempting this, the procedure can be considered when a diagnosis of obstructive pyonephritis is made. Wow. So for veterinarians, just take away from this that this is a very niche procedure done in very select locations, and the ability to salvage a kidney for cases like this is possible. For pet owners, understand that unless you're looking for a quick fix, and if you have the opportunity to talk with specialists and travel to places that will allow procedures like this, then yes, you can go ahead and seek out those options, or your vet can refer you. This is by no means a common scenario, and the dogs that fit the bill for this are a very small percentage of animals. So it's interesting that people are doing this kind of thing. It's awesome, but again, for veterinarians and for pet owners, there are options that are a bit more niche for cases like this that you could consider if you have the resources and access to that kind of care. All right, this is a long one. Thanks for watching this video. We'll see you tomorrow. Bye-bye.